First of all, can I congratulate the committee on the fine work they've done and in producing this report. As we know, schools play a role in promoting, supporting and developing positive mental health in their students. And we know that early intervention is critical. I myself am the chair of the Board of Management of Educate Together National School in Wexford Town. We're also looking for a new school building minister, but I'll talk to you about that another time. In March this year, I raised the need for a review of mental health guidelines and supports in schools with the then Minister for Education and Skills, Richard Browne. I talked to primary school principals and teachers on a regular basis and to get a feel and understanding of what they are experiencing within schools. Teaching staff are under pressure to solve their pupils' problems, very often owing to lengthy waiting lists, both within the psychological supports in schools, the NEPs, and also in terms of the lack of supports young people are very often getting outside of schools, in CAMS, in community psychology care. And when they don't get those supports, those issues that those children are dealing with fall back into the school, and very often it's the teachers and the principals who become active on the front line of dealing with young people and their mental health problems and challenges. We know that a quarter of all people who develop mental health problems, 50% of all people who develop mental health problems develop them before they turn 14. 1 in 4 students suffer from mental health problems, but if those students come from a minority grouping, whether they're travellers, disabilities, refugees, the LGBTQ communities, that those ratios increase fairly significantly. And if they come from a number of those categories, it goes up even further again. And it's very important that appropriate resources are put in to support both the parents, the students and the teachers in the schools' principals. I want to raise the issue in particular of increasing mental health issues for very young people in and around digital safety. Talking to, again, teachers and talking to school principals, but we're seeing the research in America and the UK on this as well, that students are starting school with speech and language issues, but they've nothing physically or mentally wrong with them. They're not used to speaking. They're starting with vocabulary issues, again, for no other reason than they are stuck on laptops, iPads, iPhones. They are not developing the necessary vocabulary that would have previously have occurred. And there is research that shows that if you assess a 5-year-old's vocabulary, you can actually predict their likelihood of employment in their 30s. Now, that's not necessarily to follow if appropriate intervention is put in place, but there is research that shows that. And that's why it's so important that if young people are behind when they start, they very rarely catch up. In fact, the research shows the gap widens, and that's why, again, there's absolutely a necessity for proper intervention. To deal with the issues of young people's mental health, we need to teach parents, teachers and students how to recognise mental health issues, develop awareness around those issues, and also to develop the confidence to speak openly about their issues, and to develop coping skills, resilience on how to deal with those issues as well. Because the reality is young people today probably don't, in general, face the same kind of crises that people might have faced 50 years ago, 60 years ago. So we need to teach them how to have those resilience mechanisms. But they're also being very much exposed to things that people in previous generations wouldn't have been exposed to until at least their teenage years or even older. They're seeing on the internet extreme violence and porn and all sorts of other things on there. And that is having a profound effect, I think, on young people as well. So again, it emphasises the importance of not just well-being programmes, but actual, I think, critical mental health interventions for those young people and their teachers, so they do. And it has to be more than just goodwill. It can't simply be about putting all of these mental health appropriate interventions onto the shoulders of already overburdened teaching staff. But that has to be backed by appropriate resources and appropriate referral pathways. So teachers who may see issues with young people know how to issue spot them and then know how to deal with those issues and where to refer them on to. And of course, that when students are referred for help and support, that those supports are in fact there. In my own county, in Wexford, in community psychology, which I appreciate doesn't come under your department, Minister, but there's a 34-month waiting list for a child to get to see a community psychologist, and they will see no urgent cases at the moment. Now, that has an impact back into your department, Minister, because those children are not getting the supports they need. Those children are going to school, and those children are going to have challenges that teachers are going to have to support them with. So it does have a knock-on effect, and I would like to see greater interaction between the Department of Education and the Department of Health, in particular the Department of Mental Health, to see how these issues can be, I think, appropriately and effectively addressed. Ireland has, it was reported, I think, about a year ago, one of the worst statistics in the developed world for depression causing young people to leave school. And again, it shows that I think that the issue of mental health is not being effectively dealt with in our schools. The Education Committee report proposes enhancing the links between schools and state agencies to support both pupils and teachers alike, and I very much welcome this, so I do. The ministerial collaboration, as I said earlier, is absolutely necessary, I think, with the other departments for mental health. And there's a huge expertise, obviously, in the Department of Mental Health that can be brought over to the Department of Education to help with as well. But look, I want to congratulate again the committee for their fine work. I wish the Minister the best with his department, and thank you very much.
Deputy Browne, wish to respond.